right, welcome back to the Beyond Electric Sheep podcast. I'm Brick Thompson.
And I'm Ed Daniels.
Ed, we talked in our last episode about how AI may be used in medicine around transcription, coding, various things like that. I know you've been doing some experiments yourself with an agent, I think. Anyway, I won't try to describe it. Why don't you tell us about that?
Yeah. Well, one of the things that I've worked on for the last 20 years, at least maybe 30, is the exchange of data among different players in the healthcare system. So ranging from the physician, clinician themselves to insurance companies to hospital medical record system to doctor's office medical record system. There's all these different elements in the healthcare system, and they all need to know, for one reason or another, clinical information about patient, and it's always been a challenge to be able to exchange that information. So back when I started in my healthcare IT career, we would basically invent the record layout of how you would transfer clinical information, or it might even in certain cases be an image, a PDF or something of a clinical document. But that whole area has advanced dramatically, and now there are multiple different kinds of standardized coding mechanisms for exchanging clinical data. And so anyway, I was just interested in that. And I of course, as anybody that listens into this podcast knows, I like to think about where this is all going. Where is AI headed in the next 30 days? No, I mean 30 years. No. Anyway, right around the corner. Where is all this going? And in the back of my mind, I was saying, well, gosh, all this work that we were doing, standardizing all these coding mechanisms to store and exchange clinical data, is that going to be a waste of time? I mean, what if each doc or each hospital has their own AI agent and they're tracking all these clinical activities, and if you want to inform another organization, an insurance company or another hospital, let's say the patient gets transferred from hospital A to hospital B, couldn't these AIs just talk to each other and pass this information over? What do you need all that work we've done for the last 30 years for? And so I decided to experiment with that with my buddy GPT-4.
Okay, So it just occurs to me as a layperson, one of the challenges would be making sure that the information you're transferring is interpreted correctly. And that's why for decades you and so many other people in healthcare IT have had coding and formats and all of that. Do you think you have to come up with a new format or a new coding for the AIs, or are they just going to be so smart at contextual stuff they can figure it out?
Well, let me tell you a little story about this. This all transpired yesterday, actually. But I was thinking, I like to write papers and Medium articles about these topics that I think are really relevant to the AI revolution. So I decided to write a paper about this question. What's the future of these standardized data exchange mechanisms and coding mechanisms? And so I sort of did a little outline, which is, well, how is AI going to help us do a better job of using these, but also how's AI going to be a threat to the use of these, and will they even be needed anymore? And so I put that outline and I passed it over to GPT-4 and started asking some questions about that. And it, helped me flesh out the outline, think a little bit more about the pros and cons. And then I decided, and so I started fleshing out the paper, but I decided, well, let's experiment with some little more realistic case. And so then from there, I uploaded a synthetic physical examination and history document that I had. It wasn't a real patient, but it was essentially a real record. This is what a real history and physical exam taken by a physician would look like.
Okay.
So I uploaded that to GPT-4 and said, okay, tell me what you think about this patient. And GPT-4 said, well, it's a 59-year-old female. It has a history of hypertension and is, at risk by family history of coronary artery disease and, potential heart attack. Da, 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 da. So I was just testing to see if it really could read the record and say something about it. So it did a good job of that. And then
was it accurate? I mean, did you go back and look? And
yeah, it was accurate.
Okay, yeah. It sounds pretty high level, superficial.
Yeah, it was. Well, it was kind of what let's say a second-year medical student would do.
Okay.
Not. I didn't have errors in it necessarily, but it was just what I asked for, which is a quick summary of this document, which summarized again the history and physical exam, and then I said, okay, well, so what ICD-10 codes would apply to this patient? And an ICD-10 code is a definition of the particular disease or injury of a patient, and I don't know how many are in thousands of ICD-10 codes that apply to any given patient, and so the GPT-4 started spitting out ICD-10 codes that would apply to this particular patient.
Okay.
Okay, good. I know this is your next question, but I didn't actually go and validate that those were the accurate codes, but, that's probably the next step for me to do.
Sure. Okay.
So then I said, well, what actions would you take for this patient, and those are a little different kind of code. It's a CPT code, which defines particular procedures that are performed on a patient. And so I asked GPT-4 what CPT codes would apply to this patient. Well, first I asked what it would do with this patient, and namely they're going to admit this patient to the hospital. They're at a high risk of having a coronary, and so they would admit the patient. He would admit she, whatever, would admit the patient, would do these various diagnostic tests, et cetera. Each one had a CPT code, and it explained what the CPT code was. So I thought, okay, well, that's interesting. And this is just an out-of-the-box subscription to OpenAI's GPT-4. So no specialized medical tool or anything. And then I said, and if you have to file a claim for the medications that you would provide this patient, what's the NCPDP code that you would file for the particular medications that would be administered to this patient? So it came up with a whole list of those codes, which I thought was interesting. And then I said, okay, so let's say that we move this patient over to another hospital. There are various transactions that occur related to the transfer of that patient. They might be done in a HL7 messages, which is another standardized mechanism for exchanging clinical data and activities of the patient. So it spit out about 5 or 10 different types of HL7 messages that would be created to explain or communicate this patient's motion. And then, anyway, I continued in all these different codes the GPT-4 was able to come up with. Again, I haven't validated them all, and one would want to validate them, but did a great job of that.
You might, I don't know, but you might take those codes and just feed the codes in to a separate session and say, okay, tell me about this.
Definitely.
That would be interesting. It wouldn't prove it, but
no, but I might do that. I mean, of course, I recorded this that entire session, so there'd be no reason not to do that. And we could go over to Gemini or something like that and see what another type of AI would have to say about that.
Right, and you can see a situation where you actually trained an AI specifically deeply on these codes and on medicine. I'm sure you'd start getting really good results.
Definitely.
Oh,
So just to sort of wrap up this little experiment, I said, well, so if you were an AI for this hospital, and then we're going to transfer this patient to another hospital that has its own AI, would we use a standardized mechanism like FHIR, which is another standard for exchanging clinical information, to tell the other AI about what's headed its way in terms of a patient? Or could you guys just talk to each other and you wouldn't have to use any of these standardized coding mechanisms? And I thought it was very insightful because it gave the answer that I think I would have given, which is no, these codes are accurate ways of breaking down the condition of the patient and the types of treatment and actions. And so I would want to communicate utilizing these standardized codes with my colleague over there at the other hospital. True, we could figure out our own communication, but then it wouldn't be auditable. It wouldn't be able to be, reviewed by other humans. It wouldn't be able to be stored and recorded for future use. So no, I would definitely use these standard mechanisms in order to communicate this data. So anyway,
That's
I thought
cool.
that was interesting.
Yeah, I wonder if you could ask it to come up with a more efficient. But anyway, that's a whole, fascinating. All right, well, we're at time. Why don't we wrap and
Okay,
we'll maybe expand on this in the next episode.
sounds good.
All right, thanks.